Now, let's look at what is hemophilia. Hemophilia is an inherited bleeding disorder in which the blood does not clot properly, which will lead to spontaneous bleeding following injuries or surgery. People with hemophilia have low levels of clotting factor 8 or factor 9. The severity is determined by the amount of clotting factor in the blood. Spontaneous or internal bleeding have often painful swollen joints due to bleeding in the joints. The following two are the most common types of hemophilia. Hemophilia A, known as a classical hemophilia, which is the most common form caused by having low levels of clotting factor 8, and hemophilia B, known as the Christmas disease, caused by having low levels of clotting factor 9.
Let's see how joints are affected by hemophilic bleeding. The hinge joints such as knees, ankles, and elbows are more commonly affected by hemophilic bleeding than the other joints. This is attributed to two main reasons. First, these joints have one degree of freedom of movement, meaning they can only flex and extend. Second, the hinge joints are not surrounded by protective muscles. Joints such as hip and shoulder have multiple degree of freedom of movement and can move around in many directions without strain. So these parts are not affected by bleeds as often as the hinge joints. Moreover, the hip and shoulder joints are covered by many layers of strong muscles. Next, let's see how muscles are affected by hemophilic bleeding. Mobilizer muscles produce movement and work only when they are needed to perform a particular task. These muscles work in short bursts and made up mainly of muscle fiber types that fatigues quickly. In people with hemophilia, the mobilizer muscles become tight and painful and easily injured if they are stretched or overworked. Muscles that react by tightening and weakening include forearm flexors, quadriceps, biceps, hip flexor, hamstrings, and calf muscles. Next, people with hemophilia who had many bleeds tend to develop a distinctive posture that may include flexion deformities of the knees, hips, wrists, and fingers. This develops in according to the position that joints and muscle prefer when there is bleed in the area. Hence, patients with bleeding disorder may experience limitation in sport participation and physical activity. Contact sports like football, wrestling, hockey, and BMX racing are not safe for people with hemophilia because there are more chances of getting hurt in these sports.